Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 50 practice NCLEX questions. Without the way, let's get started.
The nurse is planning care with a Mexican client who is diagnosed with depression. The client believes in Mal Oyo, the evil eye, and uses treatment by a root healer. The nurse should do which of the following? 1. Avoid talking to the client about the root healer. 2. Explain to the client that Western medicine has a scientific, not mystical, basis. 3. Explain that such beliefs are superstitious and should be forgotten. 4. Involve the root healer in a consultation with the client, primary healthcare provider, and nurse. The correct answer is for involve the root healer in a consultation with the client, primary healthcare provider, and nurse. Rationale. Including the root healer gives credibility and respect to the client's cultural beliefs. Avoiding talking about the healer demonstrates either ignorance or disregard for the client's cultural values. Negative comparison of root healing with Western medicine not only denigrates the client's beliefs, but is likely to alienate and cause the client to end treatment.
A newborn is diagnosed with a congenital heart defect. The test results reveal that the lumen of the duct between the aorta and pulmonary artery remains open. This defect is known as blank. The correct answer is patent ductus arteriosus. This is a defect with increased pulmonary flow. It should close in the first few weeks of life. Which statement best describes the scientific rationale for administering aluminum hydroxide to a client diagnosed with chronic kidney disease? 1. This medication neutralizes gastric acid production. 2. It binds to phosphorus to help decrease hyperphosphatemia. 3. The medication is administered to decrease the calcium level. 4. It will help decrease episodes of constipation in the client with CKD. The correct answer is 2. It binds to phosphorus to help decrease hyperphosphatemia. Clients with CKD experience an increase in serum phosphorus levels, and administering aluminum hydroxide, an antacid, binds with phosphorus to be excreted in the feces. Option 1 is the scientific rationale for administering antacids to clients with peptic ulcer disease or gastritis, not clients with CKD. Aluminum hydroxide does not affect the calcium level. Aluminum hydroxide can cause constipation. It is not used to treat constipation. The client diagnosed with a right-sided cerebrovascular accident is admitted to the rehabilitation unit. Which interventions should be included in the nursing care plan? Select all that apply. 1. Position the client to prevent shoulder adduction. 2. Turn and reposition the client every shift. 3. Encourage the client to move the affected side. 4. Perform quadriceps exercises 3 times a day. 5. Instruct the client to hold the fingers in a fist. The correct answers are 1. Position the client to prevent shoulder adduction, and 3. Encourage the client to move the affected side. Placing a small pillow under the shoulder will prevent the shoulder from adducting toward the chest and developing a contracture. The client should not ignore the paralyzed side, and the nurse must encourage the client to move it as much as possible. A written schedule may assist the client in exercising. A client is admitted to the hospital with a diagnosis of cholecystitis from cholelithiasis. The client has severe abdominal pain and nausea and has vomited several times. Based on these data, which nursing action would have the highest priority for intervention at this time? 1. Manage anxiety. 2. Restore fluid loss. 3. Manage the pain. 4. Replace nutritional loss. The correct answer is 3. Manage the pain. The priority for nursing care at this time is to decrease the client's severe abdominal pain. The pain, which is frequently accompanied by nausea and vomiting, is caused by biliary spasm. Opioid analgesics are given to relieve the severe pain and spasm of cholecystitis. Relief of pain may decrease nausea and vomiting and thereby decrease the client's likelihood of developing further complications, such as severe fluid loss and inadequate nutrition. There are no data to suggest that the client is anxious. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
During the assessment of a client's mouth, the nurse notes the absence of saliva. The client reports having pain behind the ear. The client has been nothing by mouth for several days, but now can have liquids. Based on these findings, the nurse should do which of the following? 1. Request a prescription for an antifungal mouthwash. 2. Instruct the client to brush the gums as well as the teeth. 3. Encourage the client to suck on hard candy. 4. Give the client a hydrogen peroxide-based mouthwash. The correct answer is 3. The lack of saliva, pain near the area of the ear, and the prolonged NPO status of the client are indications that the client may be developing parotitis or inflammation of the parotid gland. Parotitis usually develops with dehydration combined with poor oral hygiene, or when clients have been NPO for an extended period. Preventive measures include the use of sugarless hard candy or gum to stimulate saliva production, adequate hydration, and frequent mouth care. The client does not have indications of stomatitis, which produces excessive salivation and a sore mouth. The client does not have indications of oral candidiasis, which causes bluish-white mouth lesions, and a nurse does not need to request a prescription for an antifungal mouthwash. There are no indications that the client has gingivitis, which can be recognized by the inflamed gingiva and bleeding that occurred during toothbrushing, and while the client should brush the teeth and gums, increasing salivation to prevent parotitis is a priority at this time. An adolescent with chest pain goes to the school nurse. The nurse determines that the teenager has a history of asthma, but has had no problem for years. Which of the following should the nurse do next? 1. Call the adolescent's parent. 2. Have the adolescent lie down for 30 minutes. 3. Obtain a peak flow reading. 4. Give 2 puffs of a short-acting bronchodilator. The correct answer is 3. Problems of chest pain in children and adolescents are rarely cardiac. With a history of asthma, the most likely cause of the chest pain is related to the asthma. Therefore, the nurse should check the adolescent's peak flow reading to evaluate the status of the airflow. Calling the adolescent's parent would be appropriate, but this will be done after the nurse obtains a peak flow reading and additional assessment data. Having the adolescent lie down may be an option, but more data need to be collected to help establish a possible cause. Because the adolescent has not experienced any asthma problems for a long time, it would be inappropriate for the nurse to administer a short-acting bronchodilator at this time. An older adult is admitted to the telemetry unit for placement of a permanent pacemaker because of sinus bradycardia. A priority goal for the client within 24 hours after insertion of a permanent pacemaker is to 1. Maintain skin integrity. 2. Maintain cardiac induction stability. 3. Decrease cardiac output. 4. Increase activity level. The correct answer is 2. Maintaining cardiac induction stability to prevent arrhythmias is a priority immediately after artificial pacemaker implantation. The client should have continuous electrocardiographic monitoring until proper pacemaker functioning is verified. Skin integrity, while important, is not an immediate concern. The pacemaker is used to increase heart rate and cardiac output, not decrease it. The client should limit activity for the first 24 to 48 hours after pacemaker insertion. The client should also restrict movement of the affected extremity for 24 hours.
A client with Graves' disease is treated with radioactive iodine in the form of sodium iodide, I-131. Which of the following statements by the nurse will explain to the client how the drug works? 1. The RAI stabilizes the thyroid hormone levels before a thyroidectomy. 2. The RAI reduces uptake of thyroxine and thereby improves your condition. 3. The RAI lowers the levels of thyroid hormones by slowing your body's production of them. 4. The RAI destroys thyroid tissue so that thyroid hormones are no longer produced. The correct answer is 4. The RAI destroys thyroid tissue so that thyroid hormones are no longer produced. Sodium iodide, I-131, destroys the thyroid follicular cells, and thyroid hormones are no longer produced. RAI is commonly recommended for clients with Graves' disease, especially the elderly. The treatment results in a medical thyroidectomy. RAI is given in lieu of surgery, not before surgery. RAI does not reduce uptake of thyroxine. The outcome of giving RAI is the destruction of the thyroid follicular cells. It is possible to slow the production of thyroid hormones with RAI. A client is admitted with a myocardial infarction and atrial fibrillation. While auscultating the heart, the nurse notes an irregular heart rate and hears an extra heart sound at the apex after the S2 that remains constant throughout the respiratory cycle. The nurse should document these findings as 1. Heart rate irregular with S3. 2. Heart rate irregular with S4. 3. Heart rate irregular with aortic regurgitation. 4. Heart rate irregular with mitral stenosis. The correct answer is 1. Heart rate irregular with S3. An S3 heart sound occurs early in diastole as the mitral and tricuspid valves open and blood rushes into the ventricles. To distinguish an S3 from a physiologic S2 split, a split S2 occurs during inspiration, and S3 remains constant during the respiratory cycle. Its pitch is softer and best heard with the bell at the apex, and it is one of the first clinical findings in left ventricular failure. An S4 is heard in late diastole when atrial contraction pumps volume into a stiff, non-compliant ventricle. An S4 is not heard in a client with atrial fibrillation because there is no atrial contraction. Murmurs are sounds created by turbulent blood flow through an incompetent or stenotic valve. A 24-year-old Gravida 1 para-0 patient is receiving oxytocin during her labor at 41 weeks gestation. Which nursing actions are appropriate when late fetal heart rate decelerations are identified? Select all that apply. 1. Discontinue the oxytocin. 2. Decrease the maintenance IV fluid rate. 3. Administer oxygen to the mother by mask. 4. Place the woman in high Fowler position. 5. Notify the healthcare provider. 6. Discontinue epidural anesthesia. The correct answers are 1. Discontinue the oxytocin. 3. Administer oxygen to the mother by mask. And 5. Notify the healthcare provider. Late fetal heart rate decelerations can be an ominous sign of fetal hypoxemia, especially if repetitive and accompanied by decreased variability. Notification of the HCP is indicated. Turning off the oxytocin and administering oxygen to the mother are recommended nursing interventions to improve fetal oxygenation. An increase, not a decrease, in the IV rate can improve hydration, correct hypovolemia, and increase blood flow to the uterus. Putting the woman in a lateral position can increase blood flow to the uterus and increase oxygenation to the fetus. The high Fowler position would not be helpful. Discontinuation of epidural anesthesia would not be indicated in the presence of late fetal heart rate decelerations. The anesthesia may be vitally important if the condition continues or worsens and necessitates a cesarean section. Promptly addressing fetal heart rate changes may allow intrauterine resuscitation and may decrease the need for cesarean section if those measures are effective. This supports the perinatal core measure of reducing cesarean section rates.
A client diagnosed with major depression spends most of the day lying in bed with a sheet pulled over his head. Which of the following approaches by the nurse is most therapeutic? 1. Wait for the client to begin the conversation. 2. Initiate contact with the client frequently. 3. Sit outside the client's room. 4. Question the client until the client responds. The correct answer is 2. Initiate contact with the client frequently. Rationale. The nurse should initiate brief, frequent contacts throughout the day to let the client know that he is important to the nurse. This will positively affect the client's self-esteem. The nurse's action conveys acceptance of the client as a worthwhile person and provides some structure to the seemingly monotonous day. Waiting for the client to begin the conversation with the nurse is not helpful because the depressed client resists interaction and involvement with others. Sitting outside of the client's room is not productive and not necessary in this situation. If the client were actively suicidal, then a one-on-one client-to-staff assignment would be necessary. Questioning the client until he responds would overwhelm him because he could not meet the nurse's expectations to interact.
On examination, a nurse hears a murmur at the left sternal border in a child with diarrhea and fever. The parent asks why the healthcare provider never said anything about the murmur. The nurse explains. 1. The healthcare provider is not a cardiologist. 2. Murmurs are difficult to detect, especially in children. 3. The fever increased the intensity of the murmur. 4. We need to refer the child to an interventional cardiologist. The correct answer is 3. The fever increased the intensity of the murmur. The increased CO of the fever increases the intensity of the murmur, making it easier to hear. Option 1 is not a therapeutic response. This child does not need to see an interventional cardiologist. The murmur needs to be diagnosed first, and then a treatment plan would be developed. The client diagnosed with glomerulonephritis is receiving trimethoprim sulfa. Which data indicates the medication is effective? 1. A urine-specific gravity of 1.010. 2. Urinalysis with 35 white blood count high power field. 3. Urine pH of 6.9. 4. A negative urine leukocyte esterase. The correct answer is 4. A negative urine leukocyte esterase. A negative urine leukocyte esterase indicates the antibiotic trimethoprim sulfa is effective in treating the infection. Leukocytes and nitrates are used to determine bacteriuria and other sources of UTIs. Urine-specific gravity can indicate dehydration or water intoxication, but it will not provide information about a UTI. A microscopic value of 35 white blood count high power field indicates a UTI, not that the antibiotic is effective. The normal value is less than 5 WBC-HPF. Normal urine pH is 5.0 to 9.0, but the pH does not evaluate a UTI. The nurse is administering medications to clients on a urology floor. Which medication should the nurse question? 1. Ceftriaxone to a client who is pregnant. 2. Cephalexin to a client who is allergic to penicillin. 3. Trimethoprim sulfa to a client post-prostate surgery. 4. Nitrofurantoin to a client diagnosed with urinary stasis. The correct answer is 2. Cephalexin to a client who is allergic to penicillin. A cross-sensitivity exists in some clients between penicillin and cephalosporins, such as cephalexin. The nurse should assess the type of reaction that the client experienced when taking penicillin. If the client indicates any symptom of an anaphylactic reaction, the nurse will hold the medication and discuss the situation with the HCP. Ceftriaxone, a third-generation cephalosporin, is in the pregnancy risk category B. No research has shown harm to the fetus in humans or in animals. The nurse would not question this medication. There is no reason for the nurse to question trimethoprim sulfa, a sulfa antibiotic, for a client who has had prostate surgery. There is no reason for the nurse to question nitrofurantoin, a sulfa antibiotic, for a client who has urinary stasis. Nitrofurantoin is used to prevent or treat chronic UTIs. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse observes the unlicensed assistive personnel performing delegated tasks. Which action by the UAP requires immediate intervention? 1. The UAP measures the output of a client who had a transurethral resection of the prostate. 2. The UAP tells the client taking bethanechol, whose urine is green, that something must be wrong for the urine to be such an odd color. 3. The UAP encourages the client to drink a glass of water after the nurse has administered the oral antibiotic. 4. The UAP assists the client diagnosed with a urinary tract infection to the bedside commode every 2 hours. The correct answer is 2. The UAP tells the client taking bethanechol, whose urine is green, that something must be wrong for the urine to be such an odd color. A green-blue color indicates the client is taking bethanechol, a urinary stimulant used for clients with a neurogenic bladder. This is an expected color, and the UAP should not indicate that something is wrong with the client. In option 1, the urinary output should be measured frequently in a client who has had a transurethral resection of the prostate. The client will have bladder irrigation, and the indwelling catheter bag will need to be emptied frequently. The nurse would not intervene to stop this action. In option 3, the client should be encouraged to drink fluids. The nurse would not intervene to stop this action. In option 4, this action encourages bowel and urine continence and is part of falls prevention protocol. The nurse would not intervene to stop this action. A client enters the labor and delivery suite stating that she thinks she is in labor. Which of the following information about the woman should the nurse note from the woman's prenatal record before proceeding with the physical assessment? Select all that apply. 1. Weight gain. 2. Ethnicity and religion. 3. Age. 4. Type of insurance. 5. Gravidity and parity. The correct answers are 1. Weight gain. 2. Ethnicity and religion. 3. Age. And 5. Gravidity and parity. Before proceeding with a physical assessment, the nurse should check the client's weight gain reported in her prenatal record. The client's ethnicity and religion should be noted before physical assessment. This allows the nurse to proceed in a culturally sensitive manner. The client's age should also be noted before the physical assessment is begun. The type of insurance the woman has is not relevant to the nurse. The client's gravidity and parity, how many times she has been pregnant and how many times she has given birth, should also be noted before a physical assessment is begun. A woman who states that she thinks she is in labor enters the labor suite. Which of the following assessments will provide the nurse with the most valuable information regarding the client's labor status? 1. Leopold maneuvers. 2. Fundal contractility. 3. Fetal heart assessment. 4. Vaginal examination. The correct answer is 4. Vaginal examination. Leopold maneuvers, although performed on a woman in labor, assess for fetal position, not the progress of labor. Fundal contractility will assess for uterine contractions, but this is not the most valuable information. Assessment of the fetal heart is critically important in relation to fetal well-being, but it will not determine the progress of labor. A vaginal examination will provide the nurse with the best information about the status of labor. A client in labor, G2P1001, was admitted 1 hour ago at 2 centimeters dilated and 50% effaced. She was talkative and excited at that time. During the past 10 minutes, she has become serious, closing her eyes and breathing rapidly with each contraction. Which of the following is an accurate nursing assessment of the situation? 1. The client had poor childbirth education prior to labor. 2. The client is exhibiting an expected behavior for labor. 3. The client is becoming hypoxic and hypercapnic. 4. The client needs her alpha-fetoprotein levels checked. The correct answer is 2. The client is exhibiting an expected behavior for labor. There is no indication that this woman has had poor preparation for childbirth. The woman is showing expected signs of the active phase of labor. There is no indication that this woman is showing signs of hypoxia and/or hypercapnia. The alpha-fetoprotein assessment is a test to screen for Down syndrome and neural tube defects in the fetus. It is done during pregnancy. A woman has just arrived at the labor and delivery suite. To report the client's status to her primary healthcare practitioner, which of the following assessments should the nurse perform? Select all that apply. 1. Fetal heart rate. 2. Contraction pattern. 3. Urinalysis. 4. Vital signs. 5. Biophysical profile. The correct answers are 1. Fetal heart rate. 2. Contraction pattern. And 4. Vital signs. The nurse should assess the fetal heart before reporting the client's status to the healthcare provider. The nurse should assess the contraction pattern before reporting the client's status. A complete urinalysis would likely be ordered by the primary healthcare practitioner once the client has been officially admitted, but the test would not be performed during the initial assessment process. The nurse should assess the woman's vital signs before reporting her status. A biophysical profile is performed only if ordered by a healthcare practitioner. While performing Leopold maneuvers on a woman in labor, the nurse palpates a hard round mass in the fundal area, a flat surface on the left side, small objects on the right side, and a soft round mass just above the symphysis. Which of the following is a reasonable conclusion by the nurse? 1. The fetal position is transverse. 2. The fetal presentation is vertex. 3. The fetal lie is vertical. 4. The fetal attitude is flexed. The correct answer is 3. The fetal lie is vertical. With the palpation findings of a hard round mass in the fundal area and soft round mass above the symphysis, the nurse can conclude that the fetal position is not transverse. The nurse can conclude that the fetal lie is vertical. The attitude is difficult to determine when performing Leopold maneuvers. When during the latent phase of labor, should the nurse assess the fetal heart pattern of a low-risk woman, G1P0000? Select all that apply. 1. After vaginal examinations. 2. Before administration of analgesics. 3. Periodically at the end of a contraction. 4. Every 10 minutes. 5. Before ambulating. The correct answers are 1. After vaginal examinations. 2. Before administration of analgesics. 3. Periodically at the end of a contraction. And 5. Before ambulating. The nurse should assess the fetal heart after all vaginal examinations. The nurse should assess the fetal heart before giving the mother any analgesics. The fetal heart should be assessed periodically at the end of a contraction. The fetal heart pattern should be assessed every hour during the latent phase of a low-risk labor. It is not standard protocol to assess every 10 minutes. The nurse should assess the fetal heart before the woman ambulates. The nurse is assessing the fetal station during a vaginal examination. Which of the following structures should the nurse palpate? 1. Sacral promontory. 2. Ischial spines. 3. Cervix. 4. Symphysis pubis. The correct answer is 2. Ischial spines. Palpating the sacral promontory assesses the obstetric conjugate, not the fetal station. Station is assessed by palpating the ischial spines. Palpating the cervix assesses dilation and effacement, not fetal station. Palpating the symphysis, pubis assesses the obstetric conjugate, not the fetal station. The labor and delivery nurse is performing Leopold maneuvers. A soft round mass is felt in the fundal region. A flat object is noted on the left, and small objects are noted on the right of the uterus. A hard round mass is noted above the symphysis. Which of the following positions is consistent with these findings? 1. Left occipital anterior. 2. Left sacral posterior. 3. Right mentum anterior. 4. Right sacral posterior. The correct answer is 1. Left occipital anterior. The nurse's findings upon performing Leopold maneuvers indicate that the fetus is in the left occiput anterior position. That is, the fetal back is felt on the mother's left side. The small parts are felt on her right side. The buttocks are felt in the fundal region, and the head is felt above her symphysis. In the left sacral posterior position, the fetus's buttocks are facing toward the mother's left posterior. A hard round mass is felt in the fundal region, and a soft round mass is felt above the symphysis. In the right mentum anterior position, the fetus's face is facing toward the mother's right anterior, and small objects are felt on the right of the mother's abdomen with a flat area felt on the mother's left side. In the right sacral posterior position, the fetus's sacrum is facing the mother's right posterior, and a hard round mass is felt in the fundal region, while a soft round mass is felt above the symphysis. A nurse is caring for a laboring woman who is in transition. Which of the following signs, symptoms would indicate that the woman is progressing into the second stage of labor? Select all that apply. 1. Bulging perineum. 2. Increased bloody show. 3. Spontaneous rupture of the membranes. 4. Uncontrollable urge to push. 5. Inability to breathe through contractions. The correct answers are 1. Bulging perineum. 2. Increased bloody show. And 4. Uncontrollable urge to push. A bulging perineum indicates progression to the second stage of labor. The bloody show increases as a woman enters the second stage of labor. The amniotic sac can rupture at any time. With a fully dilated cervix and bulging perineum, laboring women usually feel a strong urge to push. The gravita's ability to work with her labor is more dependent on her level of pain and her preparation for labor than on the phases and or stages of labor. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which statement by the student nurse to the 21-year-old pregnant woman who smokes would require the supervising nurse to intervene? 1. Pregnancy is an excellent time to quit smoking. 2. Vaping instead of smoking during pregnancy is less risky. 3. You should not allow anyone to smoke around you during pregnancy. 4. You should not allow anyone to smoke around the baby when she is born. The correct answer is 2. Vaping instead of smoking during pregnancy is less risky. The nurse would need to intervene to correct erroneous information being given to the patient. Vaping is not safer than smoking in pregnancy. Babies born to mothers who vape have levels of nicotine exposure, low birth weight, and shortened gestational age equal to infants born to mothers who smoke. Clear advice about pregnancy being an excellent time to quit and then providing resources to do so is appropriate education. Advising the mother to avoid secondhand smoke during the pregnancy and after delivery is appropriate advice.
After a period of unsuccessful treatment with amitriptyline, a woman diagnosed with depression is switched to tranylcypromine. Which statement by the client indicates the client understands the side effects of tranylcypromine? 1. I need to increase my intake of sodium. 2. I must refrain from strenuous exercise. 3. I must refrain from eating aged cheese or yeast products. 4. I should decrease my intake of foods containing sugar. The correct answer is 3. I must refrain from eating aged cheese or yeast products. Rationale. Cheese and yeast products contain tyramine, which the client should avoid to prevent a negative interaction with tranylcypromine, a monoamine oxidase inhibitor. Sodium will not interact with tranylcypromine, and neither exercise nor sugar needs to be limited.
Tetralogy of Fallot involves which defects? Select all that apply. 1. Ventricular septal defect. 2. Right ventricular hypertrophy. 3. Left ventricular hypertrophy. 4. Pulmonic stenosis. 5. Pulmonic atresia. 6. Overriding aorta. 7. Patent ductus arteriosus. The correct answers are 1. Ventricular septal defect. 2. Right ventricular hypertrophy. 4. Pulmonic stenosis. And 6. Overriding aorta. Tetralogy of Fallot is a congenital defect with a ventricular septal defect, right ventricular hypertrophy, pulmonary valve stenosis, and overriding aorta. Pulmonary stenosis causes decreased pulmonary flow. Which statement best describes the scientific rationale for administering calcitriol to a client diagnosed with end-stage renal disease? 1. This medication increases the availability of vitamin D in the intestines. 2. This medication stimulates excretion of calcium from the parathyroid gland. 3. This medication helps the body excrete calcium through the feces. 4. This medication increases serum calcium levels by promoting calcium absorption. The correct answer is 4. This medication increases serum calcium levels by promoting calcium absorption. Calcitriol, a vitamin D analog, increases serum calcium levels by promoting calcium absorption and thereby helps to manage hypocalcemia, which is a symptom of chronic kidney disease. Calcitriol does not affect the availability of vitamin D. Calcitriol is used to treat hypoparathyroidism, but it does not stimulate excretion of calcium from the parathyroid gland. The client in ESRD has hypocalcemia, not hypercalcemia. The nurse is planning care for a client experiencing agnosia secondary to a cerebrovascular accident. Which collaborative intervention will be included in the plan of care? 1. Observe the client swallowing for possible aspiration. 2. Position the client in a semi-Fowler's position when sleeping. 3. Place a suction setup at the client's bedside during meals. 4. Refer the client to an occupational therapist for evaluation. The correct answer is 4. Refer the client to an occupational therapist for evaluation. A collaborative intervention is an intervention in which another healthcare discipline, in this case occupational therapy, is used in the care of the client. The nurse is monitoring a client admitted with a myocardial infarction who is at risk for cardiogenic shock. The nurse should report which of the following changes on the client's chart to the physician? 1. Urine output. 2. Heart rate. 3. Blood pressure. 4. Respiratory rate. The correct answer is 1. Urine output. Oliguria occurs during cardiogenic shock because there is reduced blood flow to the kidneys. Typical signs of cardiogenic shock include low blood pressure, rapid and weak pulse, decreased urine output, and signs of diminished blood flow to the brain, such as confusion and restlessness. Cardiogenic shock is a serious complication of MI, with a mortality rate approaching 90%. Fever is not a typical sign of cardiogenic shock. The other changes in vital signs on the client's chart are not as significant as the decreased urinary output.
The nurse is preparing a community presentation on oral cancer. Which of the following is a primary risk factor for oral cancer that the nurse should include in the presentation? 1. Use of alcohol. 2. Frequent use of mouthwash. 3. Lack of vitamin B12. 4. Lack of regular teeth cleaning by a dentist. The correct answer is 1. Chronic and excessive use of alcohol can lead to oral cancer. Smoking and use of smokeless tobacco are other significant risk factors. Additional risk factors include chronic irritation such as a broken tooth or ill-fitting dentures, poor dental hygiene, overexposure to sun and syphilis, use of mouthwash, lack of vitamin B12, and lack of regular teeth cleaning appointments have not been implicated as primary risk factors for oral cancer. A 7-year-old child with a history of asthma controlled without medications is referred to the school nurse by the teacher because of persistent coughing. Which of the following should the nurse do first? 1. Obtain the child's heart rate. 2. Give the child a nebulizer treatment. 3. Call a parent to obtain more information. 4. Have a parent come and pick up the child. The correct answer is 3. Because persistent coughing may indicate an asthma attack, and a 7-year-old child would be able to provide only minimal history information. It would be important to obtain information from the parent. Although determining the child's heart rate is an important part of the assessment, it would be done after the history is obtained. More information needs to be obtained before giving the child a nebulizer treatment. Although it may be necessary for the parent to come and pick up the child, a thorough assessment, including history information, should be obtained first. The client, who had a permanent pacemaker implanted 2 days earlier, is being discharged from the hospital. The client understands the discharge plan when the client 1. Selects a low cholesterol diet to control coronary artery disease. 2. States a need for bed rest for 1 week after discharge. 3. Verbalizes safety precautions needed to prevent pacemaker malfunction. 4. Explains signs and symptoms of myocardial infarction. The correct answer is 3. Education is a major component of the discharge plan for a client with an artificial pacemaker. The client with a permanent pacemaker needs to be able to state specific information about safety precautions, such as to refrain from lifting more than 3 pounds or stretching and bending, and to count the pulse once per week that are necessary to maintain proper pacemaker function. The client will not necessarily be placed on a low cholesterol diet. The client should resume activities as he is able and does not need to remain on bed rest. The client should know signs and symptoms of MI, but is not at risk because of the pacemaker.
After treatment with radioactive iodine in the form of sodium iodide, I-131, the nurse teaches the client to 1. Monitor for signs and symptoms of hyperthyroidism. 2. Rest for 1 week to prevent complications of the medication. 3. Take thyroxine replacement for the remainder of the client's life. 4. Assess for hypertension and tachycardia resulting from altered thyroid activity. The correct answer is 3. Take thyroxine replacement for the remainder of the client's life. The client needs to be educated about the need for lifelong thyroid hormone replacement. Permanent hypothyroidism is the major complication of RAI I-131 treatment. Lifelong medical follow-up and thyroid replacement are warranted. The client needs to monitor for signs and symptoms of hypothyroidism, not hyperthyroidism. Resting for 1 week is not necessary. Hypertension and tachycardia are signs of hyperthyroidism, not hypothyroidism. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 60-year-old comes into the emergency department with crushing substernal chest pain that radiates to the shoulder and left arm. The admitting diagnosis is acute myocardial infarction. Admission prescriptions include oxygen by nasal cannula at 4 liters per minute, complete blood count, a chest radiograph, a 12-lead electrocardiogram, and 2 milligrams of morphine sulfate given IV. The nurse should first 1. Administer the morphine. 2. Obtain a 12-lead ECG. 3. Obtain the blood work. 4. Prescribe the chest radiograph. The correct answer is 1. Administer the morphine. Although obtaining the ECG, chest radiograph, and blood work are all important, the nurse's priority action should be to relieve the crushing chest pain. Therefore, administering morphine sulfate is the priority action. A pregnant woman at 12 weeks gestation tells the nurse that she is a vegetarian. Which action would the nurse take first? 1. Recommend vitamin B12 and iron supplementation. 2. Recommend consumption of protein drinks daily. 3. Obtain a 24-hour diet recall history. 4. Determine the reason for her vegetarian diet. The correct answer is 3. Obtain a 24-hour diet recall history. The care of a vegetarian woman who is pregnant should begin with an assessment of her diet because vegetarian practices vary widely. The nurse must first assess exactly what the woman's diet consists of and then determine any deficiencies. It is probable that the woman will need a vitamin B12 supplement, but the assessment comes first. Vegetarian diets can be completely adequate in protein, and therefore protein supplementation is not routinely recommended. The reason for the diet is less important than what the diet actually contains.
The client exhibits a flat affect, psychomotor retardation, and depressed mood. The nurse attempts to engage the client in an interaction, but the client does not respond to the nurse. Which response by the nurse is most appropriate? 1. I'll sit here with you for 15 minutes. 2. I'll come back a little bit later to talk. 3. I'll find someone else for you to talk with. 4. I'll get you something to read. The correct answer is 1. I'll sit here with you for 15 minutes. Rationale. The most appropriate action is for the nurse to remain with the client even if the client does not engage in conversation with the nurse. A client with severe depression may be unable to engage in an interaction with the nurse because the client feels worthless and lacks the necessary energy to do so. However, the nurse's presence conveys acceptance and caring, thus helping to increase the client's self-worth. Telling the client that the nurse will come back later, stating that the nurse will find someone else for the client to talk with, or telling the client that the nurse will get her something to read conveys to the client that she is not important, reinforcing the client's negative view of herself. Additionally, such statements interfere with the client's development of a sense of security and trust in the nurse.
While assessing a newborn with respiratory distress, the nurse auscultates a machine-like heart murmur. Other findings are a wide pulse pressure, periods of apnea, increased PaCO2, and decreased PO2. The nurse suspects that the newborn has 1. Pulmonary hypertension. 2. Patent ductus arteriosus. 3. Ventricular septal defect. 4. Bronchopulmonary dysplasia. The correct answer is 2. Patent ductus arteriosus. The main identifier is the machine-like murmur, which is the hallmark of a patent ductus arteriosus. Pulmonary hypertension is a pulmonary condition which does not create a heart murmur. A ventricular septal defect does not produce a machine-like murmur. Bronchopulmonary dysplasia is a pulmonary condition which does not create a heart murmur. Which are the most serious complications for a child with Kawasaki disease? Select all that apply. 1. Coronary thrombosis. 2. Coronary stenosis. 3. Coronary artery aneurysm. 4. Hypocoagulability. 5. Decreased sedimentation rate. 6. Hypoplastic left heart syndrome. The correct answers are 1. Coronary thrombosis, 2. Coronary stenosis, and 3. Coronary artery aneurysm. Thrombosis, stenosis, and aneurysm affect blood vessels. The child with Kawasaki disease has hypercoagulability and an increased sedimentation rate due to inflammation. Hypoplastic left heart syndrome is a congenital heart defect and has no relation to Kawasaki disease. A child who has reddened eyes with no discharge, red, swollen, and peeling palms and soles of the feet, dry, cracked lips, and a strawberry tongue most likely has blank. The correct answer is 1. Kawasaki disease. Classic signs of Kawasaki disease include red eyes with no discharge, dry, cracked lips, strawberry tongue, and red, swollen, and peeling palms and soles of the feet. Incidence of Kawasaki disease is higher in males. The strongest indicator for this disease is the hallmark strawberry tongue. The nurse is caring for clients in an oncology unit. Which neutropenia precautions should be implemented? 1. Hold all venipuncture sites for at least 5 minutes. 2. Limit fresh fruits and flowers. 3. Place all clients in reverse isolation. 4. Have the clients use a soft bristle toothbrush. The correct answer is 2. Limit fresh fruits and flowers. Fresh fruits and flowers may carry bacteria or insects on the skin of the fruit or dirt on the flowers and leaves, so they are restricted around clients with low white blood cell counts. Option 1 would be done for thrombocytopenia, not neutropenia. Clients with severe neutropenia may be placed in reverse isolation, but not all clients with neutropenia will be placed in reverse isolation. Clients are at a greater risk for infecting themselves from endogenous fungi and bacteria than from being exposed to non-infectious individuals. Option 4 is an intervention for thrombocytopenia. Option 3 has the word all in it, which would make you not select this option. The nurse is assessing a client diagnosed with acute myeloid leukemia. Which assessment data support this diagnosis? 1. Fever and infections. 2. Nausea and vomiting. 3. Excessive energy and high platelet counts. 4. Cervical lymph node enlargement and positive acid-fast bacillus. The correct answer is 1. Fever and infections. Fever and infection are hallmark symptoms of leukemia. They occur because the bone marrow is unable to produce white blood cells of the number and maturity needed to fight infection. Nausea and vomiting are symptoms related to the treatment of cancer, but not to the diagnosis of leukemia. The clients are frequently fatigued and have low platelet counts. The platelet count is low as a result of the inability of the bone marrow to produce the needed cells. In some forms of leukemia, the bone marrow is not producing cells at all, and in others, the bone marrow is stuck producing tens of thousands of immature cells. Cervical lymph node enlargement is associated with Hodgkin's lymphoma, and positive acid-fast bacillus is diagnostic for tuberculosis. Option 3 could be eliminated right off the bat because of the excessive energy. Illness normally drains energy reserves. It does not increase them. The client diagnosed with leukemia has central nervous system involvement. Which instruction should the nurse teach? 1. Sleep with the head of the bed elevated to prevent increased intracranial pressure. 2. Take analgesic medication for pain only when the pain becomes severe. 3. Explain radiation therapy to the head may result in permanent hair loss. 4. Discuss end-of-life decisions prior to cognitive deterioration. The correct answer is 3. Explain radiation therapy to the head may result in permanent hair loss. Radiation therapy to the head and scalp area is the treatment of choice for central nervous system involvement of any cancer. Radiation therapy has longer-lasting side effects than chemotherapy. If the radiation therapy destroys the hair follicles, the hair will not grow back. Sleeping with the head of the bed elevated might relieve some intracranial pressure, but it will not prevent increased intracranial pressure from occurring. Analgesic medications for clients with cancer are given on a scheduled basis with a fast-acting analgesic administered PRN for breakthrough pain. Cognitive deterioration does not usually occur. You must be aware of the treatments used for the disease processes to answer this question, but might eliminate option 2 because it violates basic principles of pain management. The client diagnosed with leukemia is scheduled for bone marrow transplantation. Which interventions should be implemented to prepare the client for this procedure? Select all that apply. 1. Administer high-dose chemotherapy. 2. Teach the client about autologous transfusions. 3. Have the family members human leukocyte antigen typed. 4. Monitor the complete blood cell count daily. 5. Provide central line care per protocol. The correct answers are 1. Administer high-dose chemotherapy. 3. Have the family members human leukocyte antigen typed. 4. Monitor the complete blood cell count daily. And 5. Provide central line care per protocol. All of the bone marrow cells must be destroyed prior to implanting the healthy bone marrow. High-dose chemotherapy and full-body irradiation therapy are used to accomplish this. The best bone marrow donor comes from an identical twin. Next best comes from a sibling who matches. The most complications occur from a matched unrelated donor. The client's body recognizes the marrow as foreign and tries to reject it, resulting in graft versus host disease. The CBC must be monitored daily to assess for infections, anemia, and thrombocytopenia. Clients will have at least one multiple-line central venous access. These clients are seriously ill and require multiple transfusions and antibiotics. Autologous transfusions are infusions from the client himself or herself. This client has cancer involving blood tissue. To reinfuse the client's own tissues would be to purposefully give the client cancer cells. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client is diagnosed with chronic lymphocytic leukemia after routine laboratory tests during a yearly physical. Which is the scientific rationale for the random nature of discovering the illness? 1. CCL is not serious, and clients die from other causes first. 2. There are no symptoms with this form of leukemia. 3. This is a childhood illness and is self-limiting. 4. In the early stages of chronic lymphocytic leukemia, the client may be asymptomatic. The correct answer is 4. In the early stages of chronic lymphocytic leukemia, the client may be asymptomatic. In this form of leukemia, the cells seem to escape apoptosis, which results in many thousands of mature cells clogging the body. Because the cells are mature, the client may be asymptomatic in the early stages. All types of leukemia are serious and can cause death. The chronic types of leukemia are more insidious in the onset of symptoms and can have a slower progression of the disease. Chronic types of leukemia are more common in the adult population. The symptoms may have a slower onset, but anemia causing fatigue and weakness and thrombocytopenia causing bleeding can be present. Organ enlargement from infiltration may be present. Secondary symptoms of fever, night sweats, and weight loss may also be present. The client diagnosed with leukemia is being admitted for an induction course of chemotherapy. Which laboratory values indicate a diagnosis of leukemia? 1. A left shift in the white blood cell count differential. 2. A large number of WBCs that decreases after the administration of antibiotics. 3. An abnormally low hemoglobin and hematocrit level. 4. Red blood cells that are larger than normal. The correct answer is 1. A left shift in the white blood cell count differential. A left shift indicates immature white blood cells are being produced and released into the circulating blood volume. This should be investigated for the malignant process of leukemia. Leukocytosis is normal in the presence of an infection, but it should decrease as the infection clears. A low hemoglobin and hematocrit level indicates anemia and can be caused by a number of factors. Anemia does occur in leukemia, but it is not diagnostic for leukemia. Red blood cells larger than normal occur in macrocytic anemias. They are not characteristic of leukemia. You should recognize elevated WBCs resolve with antibiotics as an infection. Option 3 is not specific enough to be the correct answer. Which medication is contraindicated for a client diagnosed with leukemia? 1. Bactrim, a sulfa antibiotic. 2. Morphine, a narcotic analgesic. 3. Epigen, a biologic response modifier. 4. Gleevec, a genetic blocking agent. The correct answer is 3. Epigen, a biologic response modifier. Epigen is a biologic response modifier that stimulates the bone marrow to produce red blood cells. The bone marrow is the area of malignancy in leukemia. Stimulating the bone marrow would be generally ineffective for the desired results and would have the potential to stimulate malignant growth. Because of the ineffective or non-existent WBCs characteristic of leukemia, the body cannot fight infections, and antibiotics are given to treat infections. Leukemic infiltrations into the organs or the central nervous system cause pain. Morphine is the drug of choice for most clients with cancer. Gleevec is a drug that specifically works in leukemic cells to block the expression of the BCR-ABL protein, preventing the cells from growing and dividing. If you were not familiar with the drug mentioned in option 4, then this option would not be a good choice. Options 1 and 2 are common drugs and should not be chosen as the answer unless you know for sure they are contraindicated. The laboratory results for a male client diagnosed with leukemia include RBC count 2.1 times 10 to the power of 6 cubic millimeter, WBC count 150 times 10 to the power of 3 cubic millimeter, platelets 22 times 10 to the power of 3 cubic millimeter, potassium 3.8 milliequivalents per liter, and sodium 139 milliequivalents per liter. Based on these results, which intervention should the nurse teach the client? 1. Encourage the client to eat foods high in iron. 2. Instruct the client to use an electric razor when shaving. 3. Discuss the importance of limiting sodium in the diet. 4. Instruct the family to limit visits to once a week. The correct answer is 2. Instruct the client to use an electric razor when shaving. The platelet count of 22 times 10 to the power of 3 cubic millimeter indicates a platelet count of 22,000. The definition of thrombocytopenia is a count less than 100,000. This client is at risk for bleeding. Bleeding precautions include decreasing the risk by using soft bristle toothbrushes and electric razors and holding all venipuncture sites for a minimum of 5 minutes. The anemia that occurs in leukemia is not related to iron deficiency, and eating foods high in iron will not help. The sodium level is within normal limits. The client is encouraged to eat whatever he or she wants to eat, unless some other disease process limits food choices. The client is at risk for infection, but unless the family or significant others are ill, they should be encouraged to visit whenever possible. You could eliminate option 3 on the basis of a normal laboratory value. The RBC, WBC, and platelet values are all not in normal range. The correct answer option must address one of these values. The nurse writes a nursing problem of altered nutrition for a client diagnosed with leukemia who has received a treatment regimen of chemotherapy and radiation. Which nursing intervention should be implemented? 1. Administer an antidiarrheal medication prior to meals. 2. Monitor the client's serum albumin levels. 3. Assess for signs and symptoms of infection. 4. Provide skincare to irradiated areas. The correct answer is 2. Monitor the client's serum albumin levels. Serum albumin is a measure of the protein content in the blood that is derived from the foods eaten. Albumin monitors nutritional status. The nurse should administer an antiemetic prior to meals, not an antidiarrheal medication. Assessment of the nutritional status is indicated for this problem, not assessment of the signs and symptoms of infections. This addresses an altered skin integrity problem. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.